Medgen is a web-based electronic health record software. It is therefore accessible from any computer with any internet browser that has access to the internet. Even though it is web-based, it has the look and feel of a rich user interface, easy to navigate and learn. Medgen supports practices of all sizes from a single provider to multiple providers and staff, as well as multiple office locations. Once logged into the program, the first screen or your home page will be displayed. The home page contains all your appointments for today for the current office location. The list of appointments has the reason for the appointment as well as the current status, such as arrived, checkout, or canceled. On the right pane you will see your inbox. A summary window displays all items that need your attention. These are new lab results as well as abnormal or critical labs. Pending orders are lab, radiology, or other types of orders that are pending. Unsigned documents are encounter notes, progress notes, or scanned documents that are not signed as complete. Refill requests are sent by the pharmacies that are part of the e-prescription network. You can view these requests and either approve or deny them. Messages are inter-office emails left for you from other providers or staff. You can attach items to these messages such as a patient's chart, lab results, or any other documents. Tasks are a list of to-do items that can be assigned to different users and marked as complete when done. You can click on the patients in the left pane to open their chart, check in the patient when they arrive, or check out the patient at the end of the visit. When you check in the patient, you have the following options. You can collect any copay from the patient and print them a receipt, confirm or enter any patient's insurances, as well as scan the front and the back of the insurance card for future reference, print any patient forms or fee slips, or create the encounter record. You also have the option to check out the patient. From this screen, you have the option to collect any copays if not done during check-in, print or send any prescriptions for the patient, print requisition forms for any orders that were done during the visit, print a super bill containing CPT codes and ICD-9 codes from the visit, print and hand out to the patient any consulting provider or specialist they need to see, create a recall for future visits, print education material related to the problem and medications, or you can schedule a future appointment and print a patient reminder. To open a chart, you can click on the patient appointment or click on Open Chart to search for the patient. You can open up multiple charts at the same time and they will become a new tab on the top of the screen. Once you open the patient's chart, the first panel displays a summary of patient's alerts and reminders. These include any incomplete tasks for the patient, reminders about this patient, any health maintenance items due at this time, and any alerts placed in this patient's chart. The health maintenance items are customizable for each practice and may be based on patient's sex, age, past problems, past procedures, and other guidelines. From the left panel you can see 4 sections: Summary, Patient Information, Encounters, and Chart sections. The summary shows you active problems, allergies, current medications, and the patient's family history, social history, and past medical history. The patient information section has detailed screens including demographics, which shows the patient's name, address, contact information, date of birth, as well as you have the ability to upload the patient's picture for reference. Other actions from this screen include entering comments and notes for the patient, entering a patient's recalls, entering pre-authorization for the patient, viewing the list of the patient's appointments, entering the patient's relatives, entering advanced directives related to that patient. You also have the ability to print multiple reports for the patient, including the patient's chart, a summary of their information, or you have the ability to export the patient's chart to be transferred to another system. The next section is the patient's insurances. This is where you can view all the active and terminated insurances for that patient. You can also do real-time eligibility checking for any insurance that the patient has. The history section contains patient history such as past medical history, which can be entered in a free text format or selected from a list via clicking on the magnifying glass icon or by selecting an ICD-9 code. The list is completely expandable by clicking the plus sign to add new items to the list for future use. Most of the information from these individual sections are available directly when an encounter note is being prepared by the provider. We will show that later when we discuss the encounter note itself. Allergies and adverse reactions to medications or food can be recorded here. Problems will show you active problem lists and their ICD-9 codes, as well as patient's problem history. Medications are categorized by current, history, ineffective, or discontinued medications. You can write new prescriptions or renew one from this menu. You can also check insurance eligibility or insurance drug formularies from this screen. Prescriptions can be electronically transmitted to the patient's preferred pharmacy via eScript functionality. Superbills lists all the past procedures and CPT codes done for this patient. Order entry can be used to place new lab or diagnostic orders. Lab results will list all pending and complete labs for this patient. You can click on each order to view the tests below. Past immunizations are listed here, and new vaccine administration can be added. Health maintenance was discussed previously on the alerts and reminders screen. From here, you can update when the last time a procedure was done, as well as verify when the next time it is due. Vital signs can be taken by a PE or the provider. It is possible to do this at the time of writing the encounter note. You can use the sliders to change the values or type in the values. The BMI is automatically calculated for you. You can also carry over the past vitals for this patient and make adjustments to it for this visit. Other options available here are growth charts, and graphing the vitals over time. The consultations menu will show you each time the patient is referred to another provider or specialty. Messages are any messages that are saved in relation to the patient's chart. Flow sheets are customized views of any parameter in the system, such as lab results, medications, vital signs, etc. over a period of time. To enter notes for an encounter, select on the encounter for the day and click New Encounter Form. As you can see, the encounter form looks similar to paper forms that you may be already using. It is made up of panels highlighted with dashed borders. The look and content of this form can be customized by you. The encounter section has all the information such as patient name, age, and the provider. The first step is to select on the reason for the visit by clicking on the magnifying glass. The next step is you would select one or more problem templates. Problem templates can be customized by you to list possible sentences in the HPI, review systems, exam, or plan. For example, let's select abdominal pain. As you can see, a set of default HPI was automatically added to the note. To change any of these, you can either type over them, remove them from the list, or add additional free text to any of the sentences. Another option is using the magnifying glass icon. You will see sentences associated with abdominal pain, which you can select. You can also add new sentences to this list by clicking on the plus sign, or have the ability to reorder the list per your preference. You can also use the sentence builder to make ad hoc wording about the HPI, such as onset, severity, or duration. For review systems, you can start with all within normal limits, and then select any positives or negatives. By the way, this can be automatically programmed into the problem templates so that it defaults some to positive or negative. The same concept applies to physical exam. In the assessment and plan, you can select the diagnosis. Please note, default diagnoses can be selected as part of the abdominal pain template. From this form, you can also add procedure codes, prescribe medications, or order lab work, and they will be documented on the note for you. When writing a new medication, the system has drug-to-drug as well as drug-to-allergy checking. The system can also suggest the correct E&M level of service CPT code to use for this visit. There is also a PQRI section to report certain measures to Medicare for receiving government incentives. Once the encounter is complete, you can create a simple note or consult letter with a few mouse clicks. Documents in the chart can also be viewed by chart section. This concludes the demonstration of the Medgen EHR system. As you can see, the system is easy to use and navigate, as well as very comprehensive.